Hi, I'm Francois Coetzee. I'm the coordinator of the Rural Clinical School at Worcester. So that means I coordinate the programs of final year medical students at Worcester, as well as the longitudinal sites, Hermanus, Ceres, Robertson and Swellendam, as well as the student activities in Uppington. So I'm also a family physician. I practiced 12 years in a rural hospital and studied family medicine while I practiced there. So family medicine is a speciality which allows you to develop in all areas. That would be in leadership, in management skills, as well as clinical skills. And it's quite a challenge. It's a challenge to remain up to date in all the different specialities and to take on a leadership role in South Africa. It is often low resourced and under much pressure that you work, but it's also very rewarding because you get an opportunity to change the system as well as have an influence on patients' lives and on families. Family physicians are unique because they're the only speciality which their primary focus is to engage with families, not only patients but also the context in which patients live. So that includes families as well as the communities. So I'd like to tell you a little bit more about the programs that I'm involved with. So our focus is very much rural health, and I'm situated within the Ukwanda Centre for Rural Health. And the Rural Clinical School in Worcester hopes to train young professionals, not only medical doctors, but also of the allied health professionals with an interest in rural health. Why is that important? Almost 40% of South Africa's population live in rural areas, and only 15% or even less of healthcare practitioners practice in rural areas. So there's a massive need, and there's a big need to address access to healthcare. Therefore, we put in a lot of effort to get people enthusiastic about rural healthcare and to enjoy the benefits of helping people. So there are challenges. Having students all over the place means that I travel a lot, and I've got to be involved with lots of administration and getting all the tutoring and assessments going. So that's part of my job, making sure that everything happens in place and then sorting out lots of problems as they arise. I do enjoy it because it's a creative space. We're also part of the process in developing the new curriculum, where we will have the distributed apprenticeship, and then we'll place the whole final year class in the distributed platform outside of Tygerberg, and that will happen in 2025. Let's just a few thoughts on healthcare in South Africa. I think it's a very exciting time with lots of change happening. With the national health insurance coming in, we're having lots of South Africans trained elsewhere abroad, as well as political environment changing, infrastructure changing all the time. There are many opportunities for people to become involved in helping communities getting access to healthcare. There's lots of challenges with all these changes, yet I do think if your heart is right, if you keep to those good values that got you into medicine, you'll be able to go through these processes of change and come out excited and a leader in your environment. My advice to young healthcare professionals is to understand that it's important that you look after yourself, and practicing medicine, practicing healthcare is not just about knowledge and doing, but it's also about maintaining good values and good relationships. Don't ever neglect your relationships, and don't underestimate the change you can make while maintaining good values. Thank you.